So today we are going to be focusing on the Bobath approach. I watched a video on an older gentleman who is a stroke survivor and is now experiencing right side hemiplegia. He can't really move him so much, but he has some movement during it. So throughout my video, the client factor that was being focused on was the body structures. So the framework explains the body structures as the anatomical body parts. So within my video, it's just focusing on the legs and how they're stabilizing, his core, everything of that sort. So then moving on to performance skills. Performance skills are broken down into motor, process, and communication skills. The motor skills, it was focusing on his posture. They really focused on getting him to sit up straight throughout the session because of that core strength. It helps you with sitting, standing, pretty much everything of your daily living. And then moving on to process skills, the video really focused on the adaptation. They wanted to correct how he was standing because one of his foot kept turning inward. So they really tried to change that. They came up with a barrier, a pillow, so his feet wouldn't even be allowed to turn inward. And then lastly, the communication skills. It was regarding the relations of the treatment while standing because of how he acted towards treatment. He didn't really care if he was doing the treatment. He was fine with it, I would say. So really, what is the Bobath approach? So the Bobath approach really focuses on relearning normal movements by using the affected side and also the normal side. So they want to involve both sides. They also focus on alignment and symmetry of the trunk and pelvis. So within my treatment session, you'll see that I really focus on the anterior tilt of the pelvis and a little bit of the trunk while we're standing. You have to be able to stabilize that. And then also there is a different technique, so facilitate or inhibit depending on if the client is flaccid or spastic. It all just depends. Bobath approach and the different techniques. As you can see, my client today is experiencing right hemiplegia with the right upper and lower extremity. So we are going to get started on this treatment. One of the methods that the Bobath really focuses on, because it's supposed to normalize tone and get you back just to normally functioning. So the first thing is the anterior pelvic tilt. So if you can see, my client is a little bit slouched forward, and that's really normal for people to do that. So in order to do that, we can just feel the hips and have them almost sit up straight, like how you normally sit. So now that she is in the correct position with her pelvis, I'm going to move on to the scapula. In order to do anything with the scapula, we need to warm it up. So I'm going to do scapula abduction, adduction, elevation, depression, and then also upward rotation. And I'm going to do 5 reps of each. And since she has spasticity, we really want to focus on not stretching it right away, so we have to do it very slowly. So I'm going to do 5 reps of abduction and adduction. All right, and now elevation and depression. And then lastly, upward rotation. All right, nicely done. So just to mention that we really need to focus on not doing scapula retraction. It's known, if you want to warm up the scapula, that you do protraction and retraction, but within this technique, you don't do retraction. So now that I have positioned her into the right pelvic position, warmed up her scapula, I'm going to move her wheelchair towards the counter, and we're going to start the weight bearing process. So as I said, her right side is affected. So when we go to stand, I'm going to help guide her, put her hand on the wheelchair armrest to help push off. And then before that also, I'm going to make sure that her feet are separated and positioned equally apart besides your hip, so she can stand and then have the weight bear be equally on each side. So I'm going to go to her right side to be her support. So I'm going to slowly help put it onto the armrest. And then on the count of 3, I'm going to guide her to stand, keeping my hand on her right hand. So 1, 2, 3. All right. So now she can weight bear while pushing on the counter. So her daily routine is cleaning the counter, because a lot of times after you cook a meal, after you do anything, a lot of people like to clean the counter. So that's what I'm focusing on today. So to start, she is going to use her non-affected hand and start scapular protraction and reach across the counter and just clean it off. So as she's getting scapular protraction with that one, we are going to switch to her affected side. So with this one, obviously she cannot move it as much, so I'm going to have my hand on top of her and guide her into the scapular protraction. So after that, that is good. Throughout session, I really want to focus on her feet and if they are weight bearing equally. And to see that, you can tell the weight shift and the differentness of the hips. So now that she's done, she's going to reach back to these sides of the wheelchair, and I'm going to guide her right side, and she's going to sit down. Okay, here we go.
Okay, today I'm going to work with a client that has had a stroke and has right side hemiplegia. So we're going to use the Brunnstrom approach, and that deals with different limb synergies, the flexion and extension synergies. So we're going to work on bed mobility. We're going to work on rolling over to the unaffected side. So I'm going to have the client bring their affected arm up into shoulder extension or flexion and elbow extension. Go ahead and hold that for me. And then I'm going to help the client bring their hip and knee into flexion. And then I'm going to instruct the client to go ahead and kind of throw their weight over onto the unaffected side so they can roll to that side of the bed. The clinician can help do this in the beginning. 1 second, honey. 1 second. So we are going to go ahead and roll over, okay? Are you ready? Okay, go ahead and throw your weight over that way, and I'm going to help. Good job. Okay, and now we're going to roll back over. Perfect. You can go ahead and bring your arm down, straighten your leg out. And that is how you do bed mobility.